Every day when I meet patients, I'm still humbled. I'm humbled because my patients come from every continent, except Antarctica, but they come from every continent, from all walks of life. There's leaders of major countries that you know that came to undergo the Discseel procedure, political leaders, religious leaders, professional athletes, farmers, carpenters, just every type of person that I meet, that I love. And they've all experienced the same thing. They've gone through countless doctors being given different opinions, not based on facts, but just based on anecdote and opinion. It's different when they come to us. They come to us, and it's very straightforward. And then they undergo the procedure. The outpatient procedure gives them the exact diagnosis and then treats it at that same time. And before they leave the procedure room, I handwrite every patient a detailed note describing exactly what I saw during their annulo-gram test, and then what I treated and what to expect. In addition to that, my nurses send the patients the annulo-gram picture. The annulo-gram is a picture of the disc leaking, the annulus fibrosus, because most doctors are not yet skilled or knowledgeable enough to perform an annulo-gram. I love it when doctors see an annulo-gram for the first time. They all say the exact same thing. They say, wow, I didn't know what I didn't know, because the MRI shows nothing. But the annulo-gram, it's alive, it's static. I inject a trace amount of X-ray contrast in the disc, and I watch the contrast flow around those 17 layers of the disc, and I see it leak out onto the spinal nerve. Out of discs that are normal on the MRI has very little value. It's just a screening tool. But the annulo-gram shows me these details, and the doctors love it. It just changes their world. With all the physicians that I've trained, and now we're over 50 physicians who trained, they love the annulo-gram and the Discseel procedure, and they can't see going back to the old ways of putting corticosteroids in the epidural space. Even the FDA put out a black box warning to the entire public, warning against epidural corticosteroids, and yet still they're done on a regular basis. We all know that corticosteroids damage bones and damage soft tissue, yet they're still being done. I believe the reason they're being done is because up until today with the Discseel procedure, doctors had no options. So they would offer epidurals periodically, sometimes 3 times a year. And the only reason those epidurals provided temporary relief is because those discs were leaking. It's a leaky disc. An epidural can't treat a bone spur. An epidural can't treat a pinched nerve. It can only treat chemical inflammation. So if a patient experienced any temporary relief with an epidural, even if it was just for 4 days, that confirms the fact that it's a leaky disc. That confirms the fact that that patient does not need spine surgery, that that patient should not have spine surgery. If an epidural injection provides even the shortest amount of relief, that patient now knows that surgery is inappropriate. That patient now knows that their symptoms are chemical, because an epidural only treats chemical. It doesn't remove bone spurs. It doesn't remove pinched nerves. It treats chemical. And historically, doctors mistakenly thought, oh, if the epidural gives temporary relief and the pain comes back, that's a perfect candidate for surgery. It's quite the opposite. And I think the paradigm's going to change the same way it did with bloodletting. Remember George Washington, he had a sore throat, so they treated him by bleeding him. He didn't get better, so what did they do? They bled him more. And they bled him until he died. Same thing happened with Mozart. Same thing happened with a pope. The same thing's happening with spine surgery fusions. The doctors are recognizing that when a fusion fails, it probably doesn't make sense to do a second fusion or a third fusion. Simply start by identifying those tears with the annulo-gram of the Discseel procedure. And I call it annulo-gram because it's a picture of the annulus fibrosus. And then that annulo-gram identifies the tears. And then at that same moment, we simply treat every tear by introducing fibrin before the patients are discharged to home. It's exciting being a part of a paradigm change where patients are going in different directions. Doctors are abandoning fusions. Doctors are abandoning minimally invasive discectomies and fusions, recognizing that they still cause the same damage at the end, and the spine's damaged irreversibly after that. It's rewarding when those patients then undergo the Discseel procedure and become friends of ours. We have thousands of friends from every continent except Antarctica. So I'm still looking for someone from Antarctica, but it causes my nurses and myself to just enjoy treating all these patients who are being helped from around the world.